Hi folks, we're here today to talk about the response team that was set up in Revere in response to overdoses that have been on the rise in the last year or so. Revere started in 2007 with a mass call to grant from the state to work as a community to work to reduce fatal and non-fatal overdoses in the city of Revere. And during that time, a lot of things have happened. We have naloxone available in the city. The fire department began carrying Narcan, which is naloxone, in 2010. We have today with us, we have Kim Hanton. She's the Director of Addiction Services for North Suffolk Mental Health. Kevin Doherty from the Revere Fire Department. And KerryAnn Salemme, she is the recovery coach for the City of Revere. And we've comprised the team that we're going to talk about today on the show. So overdoses, there was new data released just yesterday on the number of overdoses and the fatal overdoses in the state of Massachusetts, and that was revised numbers because they had reported 1,008 overdoses back in April, and now the number has been increased for 2014. In 2014, there were 1,256 fatal overdoses in the state of Massachusetts. That's almost 4 overdoses a day. Overdoses have increased over the years. They've gone up 57% since 2012. Why? That's, that's some of the questions we're trying to answer, but one of the big reasons is 2 times as more people using drugs, using opioids today as there was in 2007, 2008. We have it's been a terrible problem all around the Commonwealth. So we're going to be talking about Revere and our response to it today. And with that, I think I'll start off with Kevin around this team that we came up with back in, Kevin?
Last October, we met at the Tuesday night drop-in at 265 Beach Street, which we continually run, but it was comprised of healthcare workers, people in recovery, members of the fire department, police department, Kim, Gary, myself, and KerryAnn, and we were just talking even back in October where these numbers really started to rise and jump on with the overdoses and the amount of calls the fire department were going to for opiate problems and overdoses, and what more the City of Revere can do to try to help these people suffering from this epidemic and the families also suffering from this epidemic. We had heard different cities were doing different things. Captain J. Piccarello had heard a few things about the town of Weymouth and the city of Brockton. So as a team, we started throwing out ideas and what we can do, and I myself thought we could do more as first responders and workers for the city through the fire department on our responses to these worst times in a family's life where they have to call for an overdose for a family member. And I had talked to a few different guys in my department and other people in recovery, and we came up with a little bit of a idea to steal from like the town of Weymouth and Brockton and what other communities, how they were dealing with it. And we said, oh, well, since we go to these homes on a regular basis, whether it's their good times or their bad, and a lot of the times it happens to be their bad time, and it's a tough situation to handle sometimes when you see the despair in a mother's eyes having to call for an overdose for their young child or loved one or husband or niece, nephew, whatever have you. And we said, well, since we now comprise data and keep data on these addresses and when we administer Narcan, since we've been administering it since 2010, and the firefighters who administer it see such emotion when we go on those calls and actually taking someone's lifeless body on an overdose and now giving them life back. It's very emotional, and we see that on a daily basis. I hate to say daily basis, but we said since we have this data and we're doing this so much, why don't we go to these homes afterwards, after we sat down and said, we need help. Who can we bring in on this so that we can get some help? Since we have the data, the fire department wants to be involved and wants to be a part of it and help as much as they possibly can and let these families know that they're not alone, that we go to the east, west, north, south of the city and offer help. When we go to, since we, like I said, we had comprised data, that we can give them the options, the avenues for help. So we had gone to the chief and kind of said, you know, other cities are doing a lot. Revere has obviously been doing a lot since 2010. We kind of want to do more as a department. And our chief is always ready and willing and able. He met off in the background with Department of Public Health, Washington, the senators, politicians, and ways that we can kind of go around certain policies or what we can possibly do to help different people. And he gave us the okay. We then got in touch with North Suffolk Mental Health, our friend Kim, who we meet again. We've been partners with the North Suffolk Mental Health and Carrie and this Narcan program since 2010, and said, this is kind of our thoughts. We need help, just like people who are out there struggling with addiction and things like that, to say it's okay, we need help. We don't have every answer. We don't have every answer on a call. We ask the police to help us on certain calls. We ask the Cataldo ambulance. We're led by our officers as firefighters. And we wanted to see what avenues they thought. And it's not just the Revere Fire Department. It's North Suffolk Mental Health. It's our partnership with Carrie, with KerryAnn, and to say, let's give these families information and let them know they're not alone. The mayor caught wind of it, jumped on board with it, and said, whatever resources you need, whatever we can do to help, let's just get it rolling. And it was kind of thrown at some of us, and we were hoping it was going to get taken serious, and it did, and it kind of just snowballed at that. And we were fortunate enough that Channel 5 had heard about what we were doing, and we had gone to some homes already, and they asked if they could kind of see what we're doing in the city, and our word had got out there, what we're doing, and it pushed the gas pedal to the floor, I guess you could say, to do more. That was in April, May, June. Come the end of June, July, we started the website, revererecoveryhelp.org. We've already had over 2,000 hits in less than 40 days. So there's people reaching out to us already. We have gone to 15 to 20 homes, and I can't say less than 10% maybe of that have been negative. It's all positive, and we try to push it as much as we possibly can, how confidential this is, at the same time how, I don't know how to put it, that there's so much more help than people realize is out there.
I think it's important too, if I can just, break in just for a second, Kevin, to understand why the partnership was developed too.
Right.
You alluded to the fact of having mental health providers along with recovery coaches, but it was very methodical. It wasn't just, a knee-jerk response. Because the other important piece to know, and I think the community needs to hear this, is that the firefighters and the recovery coaches are also trained. There's a competency training that they go through so that they have an understanding of what they're going to walk into, as well as really to really kind of encourage and increase the ability to bring their compassion and understanding and empathy to the table as well. Gary is also a harm reduction specialist amongst many of his other talents that he provides for us. He also trains us in what harm reduction actually is, because when we go into these homes, we have to understand that people aren't always going to be accepting and have this desire to make the changes that we maybe foresee is needed. So we have to go in with this, awareness and open-mindedness that we're there to provide them with support, education, guidance, not just, recovery and, treatment, just really kind of a wide range of just caring. Because the other piece to this that's really important is really to decrease the stigma that's attached to this, and to have families feel a little bit more accepted, to come out and talk to us about it.
Right.
So that's another piece that's really, really important for the community, for you guys to understand. We're coming to your homes. We're not here to hurt. We're really here to provide you with opportunity and support. And everybody that's coming into your house is trained. We're not coming in, and this is basically what we're doing today is we're announcing. We have done it. We've come to homes. We've really been accepted. There were a few homes that, no, we don't want you, and we backed
That's okay.
off. It is. It's very much okay. We'll still leave you with the packets. We have packets, and in our packets, there's harm reduction information, there's information on treatment, detoxes, whatever is needed, is pretty much in there. And for those of you that we haven't hit your homes yet, because, we are backlogged, we don't want you to think that you're not important. You're very important to us. We will get to you, but you also can seek us out. We will be running, there'll be different pieces run during this episode and information provided that you can, resort to. And there's phone numbers. My phone number, KerryAnn's phone number, Gary's phone number. We're all available. Drop-in center Tuesday night. And we're there every single Tuesday night from 5 to 8. And, we'll embrace anything at that time. We'll navigate, we'll support, we'll guide, so I think the most important piece is to really have an understanding. We're partnering. We're all partnering, and we want you to partner. We want the community to really be aware and partner with us. And this isn't about us, demanding or actually, implementing any of our own strategies and philosophies. It's really about us being open-minded on what's needed. So.
And it sounds like that, there's a lot of cross things between the whole team. Like KerryAnn, just to bring you in, you are identified as a recovery coach, but what would you do when you go out with the firefighters? What is your role when you get to a house if the person wants recovery, or they don't want recovery, they don't want treatment, or they do want treatment? What's your role, and how do you?
Well, I think, a lot of people still don't understand what a recovery coach actually is. It's not a counselor, it's not a sponsor, it's somewhere in between. So what a recovery coach actually is somebody who's been in long-term recovery themselves, who can give that peer-to-peer support to somebody who is actively using early in recovery, on medication, assisted treatment, whatever it might be, to know that they're not alone, and that they have somebody that can identify with them and what they're going through at that moment. And I think that it's important to have that peer-to-peer support, because sometimes when you're dealing with, a counselor or a doctor or a therapist, you feel as a drug user that you're looked down upon and that you're not seen as an equal. So when you have a recovery coach, you have somebody who says, I've been where you are now. I know what it feels like, to identify with those feelings that they have. And, they have enough guilt and shame, and people are constantly looking down at them, calling them names, and they don't need that. They already feel that about themselves. So to really just help to let them know that, I don't judge you. I'm not looking down on you. I'm here to help you. And how can I help you? It's not about telling them what works for me or what I think that they should do. It's about asking them, what do they need help with? And it might just be something as simple as, I need to get health insurance. Mm-hmm. But not knowing how to actually do it. And that's where I could come in and say, you know what, I'll help you fill out the application. I'll go with you. Just to have that support, to have somebody stand beside you and not just tell you what you need to do is huge. And that's what recovery coaching is. It's somebody to just be there to help you along your journey, and whatever that journey is, it's up to the person. It's not up to me. Whatever they want to do, whether they want to go on medication-assisted treatment, whether they want to have, just somebody to have a coffee with once a week, whatever it might be, that's my role.
Okay, and I know with the harm reduction hat that I wear a lot of times, you could possibly wear it. So what do you do with somebody that's that's maybe not ready for treatment, like what can you provide somebody they are going to continue to use their drug? What kind of things can you provide for them when you're out and the family, when they have a member in their family that's resistant to treatment? What do you provide? Like, what could you provide for that?
Well,
that
what I
group?
could provide is I could provide Narcan. I could
Okay.
train them in Narcan. I could train them in overdose prevention and the signs and symptoms and what to look for. I could teach them how to use, not in safety, but safer, you know, with clean needles, where they can go to needle exchange programs, how to make sure that they use with somebody else so they're not alone. You know, there's different things that we can work with an active user who isn't willing or ready to get help to keep them alive. That's the most important thing. If they're going to continue to use, you know, they're going to continue to use. When they're ready, they're ready. But to help them to remain safe and to stay alive, because there's always hope.
Yeah.
You know, there's always hope for that person who still wants to continue to use. And that if they know that somebody at least cares about them while they're still using, you know, there's a better chance that down the line they will want to get help.
And the point of information, harm reduction is basically it's reducing the consequences of drug use. It's not really working with, it's working with that person where they're at. So that's really basically the definition of harm reduction. To work with all the other issues around, like KerryAnn was talking about, maybe access to insurance, access to treatment, access to life-saving things like Narcan, and to reduce infections from syringes, from sharing syringes, and things like that. And Kim, to just expand a little bit on the Tuesday night drop-in that takes place at 265 Broadway. What
Beach
is the
Beach Street.
265 Beach Street? I stand corrected.
I don't want to give false information.
Yes,
yeah.
no. So what can you tell us about what some of the things that you do when people would call up or come into the drop-in center up there?
Well, I think originally what we designed the drop-in center to do was really kind of to meet people where they're at and, you know, provide them a safe, confidential arena, you know, where they could come in and really kind of discuss anything. I think initially we were doing a lot of risk reduction, you know, and harm reduction at one time, and we were providing Narcan and, you know, clean needles, you know, not distributing, but teaching people where to access. But what we seen during our journey there was a lot more families were coming in, you know, a lot more parents and siblings and you know, spouses and what their despair, and that's what we were coming across. I think, you know, a far more than the drug user was coming in. We were seeing the, you know, the families, the bystanders. So I think what we've done, you know, as a team is really kind of developed and designed, you know, a unique skill in really being able to work with the families and really kind of navigating them in different arenas that they've never had that, you know, opportunity before. There's a support group every single Monday night from 6 to 8 p.m. at 14 Porter Street in East Boston. We also have, you know, access to Learn to Cope. That's on our website, where families and friends, you know, really could benefit, because when we're talking about, you know, the harm reduction and meeting people where they're at, it's foreign language sometimes to families, and they really don't know the difference between enabling, acceptance, surrendering, you know, and also providing support. So I think that's an opportunity for us to provide them with and encourage them, because that's what they also need. They need to know that they're not alone, and we have to, you know, we have to validate, you know, where they're at. And, you know, some people want, you know, they want their drug using, you know, sibling, as the drug using child, to stay in the house. Okay, we're not going to tell you to not do that, but what we're going to do is we're going to provide you with your safety net, you know, to take care of yourself, because this disorder doesn't just affect the person, you know, that's symptomatic of it. This disorder affects the entire family. This disorder affects the entire neighborhood. This disorder affects the entire community. So, you know, we're building upon that. We're trying to meet, the drug user where they're at. We're trying to meet the family where they're at. And what we're doing here is trying to meet the community. And I really believe that that's why this community was ready for this. If it was in another community, I may not have jumped on board the way I jumped on board for this. I think the City of Revere is ready to do this work the way that they're doing it. And that's why we continue to have the drop-in center at, Beach Street, is because we are seeing families come in. It slows down a little bit in the summer. It'll build back up in the fall. We see, we see trends. But right now we're there. We're the constant, we're the constant, parties that are there. It's also an opportunity for all the firefighters to come in that have gone out on calls, and it's an opportunity for us to process what happened during the week, when we went out on calls, because there's been different things that have come up, during these, these door knocking episodes that we never realized were going to happen. So it's an opportunity for us to process, and we process with the community. Whoever's there processes with us. So the dialogue is light, and and I think it's very engaging. So that's what I think that the drop-in center provides. It's an opportunity to engage and be heard.
Yeah.
It's very intimate and emotional for a lot of for the team, not just for the firefighters or for KerryAnn or any of us, that when we go knocking on these doors, we're just offering help, and the family member has no idea, one, that we're coming, and two, that we're just here to help and let them know they're not alone. And it becomes very emotional sometimes. It becomes intimate. Almost everybody on the team has also dealt with this in a personal way, or through a family member, or through a loved one, or a fellow employee, or in their neighborhood. And that's why it's so important for the firefighters to let people know that the firefighters that are dealing with this on a daily basis, we're not just coming to your house to offer you help when you call 911. We're now coming to your house and saying we're dealing with the same problems. It's not just you on Charger Street.
Right.
It's our homes in the Pines and the Ave, Beachmont. It's everywhere, and everybody has dealt with this situation or this epidemic. We can all now say in a different way, and we have family, loved ones that are still out there active. We have family and loved ones that are in recovery, or we have family and loved ones that we wish we could get into recovery now that have passed. And that's why it's so important for us to be as a team that there's so many different avenues out there, and that there's so much help out there. Here it is. You're not alone.
Absolutely.
We're trying to get rid of that, and also that we all keep talking about is that stigma. That it's only the people walking and living on the streets. No, not by any means. It's people with jobs and that have family and loved ones, and they're our family and loved ones.
Yeah.
They're ours. They're not just the people on the corners on the streets. They're ours.
They're members of our community, and you've gotten, like you said earlier, there was, you've had 10% or under negative response. So that's 90% of response, and a lot of
positive.
Of positive response.
People that are so ecstatic and elated to say, "Oh my God, I didn't know this. Thank you."
These are family members that they don't have folks to talk to because of the stigma you're talking to. It's sometimes the way we've treated drug users for the last 100 years of demonizing them, putting them in prison, and it's not really a rehabilitative a form of policy, or it doesn't really help to keep on putting people in jail. So we're seeing a lot of positive stuff, and we're probably listening to a lot of stories. We're listening to a lot of stories out there of people that haven't had the outlet to share these stories about their sons, their daughters, their mothers, their fathers and siblings that because of shame, and it's another outlet. I think we've come a long way in the City of Revere with having the first fire department in the nation to have Narcan on all of their units, having an overdose prevention initiative that's been going on since 2007, and we continue to do this, and the numbers continually rise. In 2012, there were 11 fatal overdoses in Revere. In 2013, there were 14 fatal overdoses in Revere. And last year, there were 21 fatal overdoses in Revere. And that's because the problem, like Kevin's been saying, it's an epidemic. It's epidemic proportions right now where there's so many folks that are using opioids for one reason or another, for whatever, like self-medication, or they're just caught in the grips of substance use disorder. And I think this is a great way to address it, and it's it's really encouraging to see a city respond to it the way we are, and in other communities around the Commonwealth, because it's happening all over. It's not just in Revere. It's all over. We talk about 21 deaths in Revere in 2014. We're in the top 10 communities for fatal overdose. But there's other communities with Lynn with 34 fatal overdoses in 2014. Boston with 86 fatal overdoses last year. Worcester 4. So it's happening all around Massachusetts. Massachusetts has become like, we have quite the issue of opioid use, and we have to address it. And this is, I think, a great way to address it, reduce some of that stigma. Is there anything you like to add about the team, and like how many firefighters are on the team?
There's now 8 of us
Yeah.
that have been trained, that have gone to homes, and we've got nothing but great feedback from the firefighters, and to say that it's almost gratifying to say that we go to these overdoses and now we're doing something else.
Yeah.
We know sometimes we go to the same house multiple times, and that's okay. Continue to call 911, and to let the family know we're not just coming once. We're going to give you that another avenue, maybe the second or third time, and that we want to let you know that we're never going to not come. And if people need help out there that haven't overdosed or need help, that's what we're here for also. With the construction of our website, revererecoveryhelp.org. With that, it's almost an extra confidential that all of our personal numbers are on there, numbers to our fire alarm system, that if you're not sure of the signs and symptoms, or if you need some information, we'll then come to your house then, after, so we can try to save that overdose from happening. And it's so emotional when we come back from these calls and going out as a team to guys to say, oh my God, we could have saved that one last hit, where the family member might have not have been home to find that overdose person. We might be able to get them into treatment. We're trying to work with different detoxes and stuff to be able to get beds on the more regular, if need be, that we can try to save that one person. If we can, at this program, if we can go to 1,000 houses, we save one. As a city, we're doing great. And it's not about how many times you've overdosed, or how many times you've been to rehab, or detox, or you've tried this. It's today, and we're only worried about today. We're going to offer you as much help as we possibly can today, and use as all the resources that our offices and our leadership and our department and all of our new partners to offer. We have a lot of it, and there's a lot of help out there. And for the people that don't realize there's a lot of help out there, I couldn't have a better team in partnership with the Revere Fire Department as we do. And there's so many different avenues that I didn't even realize, even being in recovery, that there are. That there's so much even more than, and I learn every single day from KerryAnn, from Gary, from Kim, to be able to offer that help to another family member, to a person on our job who needs help. Their family members need help. We're getting calls from everywhere on a daily basis, and we hope to get 5 calls a day.
And I think it's really important to say this, and I think you touched upon it, but I want to kind of reiterate it. You don't have to overdose.
Yes.
And families don't have to have somebody overdosing in their home to really seek us.
Right.
That's the other piece that's really important. And our website information is all going to be up there. Our phone numbers are all going to be up there, and you can reach out. We will respond to you pre-overdose, and that's what we're hopeful to do. That's the whole idea behind what we're doing here today too, is that to let you know. Beside the fact that we want you to know that we are coming, and we want to introduce ourselves, that we will be, we are coming and knocking, but we also want to let you know we don't have to knock. You can knock on us too.
Right.
And
We're waiting.
I think
We have a
it's
big team.
someone. I mean, I grew up in Revere. I've seen this evolve, like drug use in Revere evolve and continually go. And I've also seen like these programs, like the fire department in 2010 when they initiated the naloxone, the Narcan on their units. We all have preconceived perceptions of what a drug user is. KerryAnn talked about it, like, and I think we've all been guilty around this table of probably like, putting labels on folks. And we're trying to like really break through that labeling and the judgment. And we had resistance at first. In 2010 we had resistance. In 2007 we had resistance. And now it's part of a culture of an evolving culture. Like everyone that I've spoken to that's part of, that's administered Narcan to a person that's been overdosing through the fire department, it seems it's helped to, it puts a face on the folks that are really at the door of death and bringing them back to life. It's a rewarding feeling, but there's also a lot of trauma, for everyone involved, including the firefighters, including the team. Like when you see folks that are almost leaving us. So I think we have a lot of work to do on stigma. I know we've done some stuff in Revere over the years. It's really help with that. And one of them is the initiative down the beach. Anybody want to talk about what we do down the beach?
The Revere Beach Memorial.
Revere Beach Memorial.
You want to take that?
So every year we, have a memorial down Revere Beach. It's usually like the second or third week in September. This year it's September 18th. It's a Sunday, and we honor the loved ones who have passed due to this illness. I mean, they're somebody's daughter, son, mother, father, brother, sister, friend. And people still find that, they're just junkies, they're losers. The stigma's still out there. It's very much still out there, and people watching this right now might have their own opinions, and everybody has their opinions, and that's fine, but until it affects you personally, or you really realize that it isn't just, the person on the corner, that it's somebody's mother or somebody's child, that's now not with us. And we need to honor their lives because they're human beings, and they were people who had personalities and were loved and, had talents and, all these great things. And we need to honor their lives. They had an illness. They were sick. If it was somebody with cancer, nobody has a problem with honoring their, that person's life. Now, if it's somebody with a substance use disorder, it's seen in a whole different light. Well, that's not a, illness, it's a choice. Well, that's not true, and people need to get educated on that. And so the Revere Beach Memorial, that's what we're trying to do, is honor those people who have passed due to this illness. And there's a lot of people on our list. There's a lot of names that we read off at that memorial, and it's a beautiful night. And it's a candlelight vigil, and you hear some personal stories from people, and some beautiful music, and you hear the names being called, and the fire department rings a bell after each name, because each one of those individuals is important, and they need to be acknowledged and remembered and loved just like anybody else who passes from any other illness. So if you're interested, come join us. It's a beautiful night. It starts at 6 or 7? 6 p.m. on September 18th. No, September 20th, right?
Whatever, I don't
Yeah,
know the
it's
exact
Sunday, September 20th. Sorry for the wrong date. So yeah, come join us and check it out.
And when you've lost a loved one, you remember that person. You remember that person for the rest of your life, and that's one night that everybody can remember that their loved one that's gone from drug-related
They're not alone.
illnesses. They're not alone, and they can talk about it with other folks down there. This is stuff that's really, it's been shameful over the decades where, when you see a 27-year-old died suddenly, and that's it, that's the end. Nobody talks, they died of an overdose. You're seeing a little bit more of that now in obituaries and things like that. People are you know, they want to get it out in the light and let people realize that this is happening to their families, to their loved ones, to our community members, to people that we've grown up with. We've grown up with these folks, and you know, it's a good night to remember. After the show, we're going to have some information on some of the contacts that everyone's talked about. Hopefully, we'll have some contact for Learn to Cope and the Drop-In Center.
That's one of our other big two partnerships with this whole program is Learn to Cope.
Yep.
And we have multiple meetings a week that we're not pushing, but letting people know are available. On Monday nights, we have the one that Kim runs
Kim in East Boston.
in East Boston. On Tuesday nights, we have the meeting that we meet at every week, and we have all the information that we can give you. If you don't even want to speak to us, and you just want the information, you can just say, I'm looking for some information. That's at 265 Beach Street every single Tuesday from 6 to 8. On Wednesday night at our fire station down the Point of Pines, there's an Al-Anon meeting. It's mostly for the parents and loved ones of someone who's suffering from alcohol and drug addiction. It's somewhere for them to go to learn that they're also not alone, and stories that have worked for certain people and aren't working, and support and community. And that it's members from our community and outside communities. And then on Thursday nights in Salem is the Learn to Cope program. Same idea of support and love, and that the people just aren't alone.
And I think we should end with making it very, very clear that this process that we've really engaged in is a confidential process. It's really important that people know that their information is confidential. And at the end of this, you'll also see there's going to be a public service announcement, and they're going to have the faces of all of us that have joined together. So when you see us coming, we hope that we won't be feared. We hope that we'll provide some comfort. So that's really how I'd like to.
And a big thank you to our city, our
Absolutely.
leadership, my offices, my chief, mayor, for the leadership that have given us this role to be able to go and try to help the people and bring this whole partnership together. We wouldn't have been able to do it without the chief, the mayor, and the
Absolutely.
Revere Police Department. It wouldn't be rolling the way it is.
Correct. Yes.
Do you have any closing? Well, then I'd like to thank everyone for joining us today, and again, use the information that you see on the screen afterwards, the public service announcement that will be coming out, and reach out to us. If we haven't reached out to you, you can reach out to us. If you need help in navigating a system around treatment, come down Tuesday night. We can help you do that stuff. If you need a Narcan, or an overdose prevention training, come down on a Tuesday night. We can provide it. And again, thank you all for joining us today. Thank you.
you.